Hi, I'm Dr. Chase Lay. I specialize in Asian facial plastics and in particular Asian eyelid surgery. I wanted to talk about selecting the right crease for your face. Now here we have a low natural looking crease that looks great on her. And in some patients selecting a crease is easy when we have asymmetry and we simply want to match one side to the other. And then there are the more dramatic changes. This deep, somewhat high crease fits very well on this patient's face. She has a strong brow, cheekbones, and nose similar to a Caucasian person. So the deep appearance of her crease looks excellent on her face. But I would never put that crease on this patient, for instance, who had a droopy eyelid and simply needed that repaired and her creases matched up. Sometimes just a small change in an existing crease is enough to give it a more pleasing appearance, and that's all you really need to do. Now, in some of my patients who are a little bit older, they simply want to go back to a very natural, low-looking crease and not look so tired, which is what we achieved in this patient's case. The goal is not to make a person look like someone completely different most of the time. And I prefer to create creases for my patients that look natural and fit their face. I occasionally do get requests for very large or dramatic changes to patients' appearance, and I'm reluctant to do so. I prefer to have patients' eyelids look normal or natural for their face. Not everyone is made the same, and not every crease for an Asian person should be made the same. These are just some more examples of patients who underwent surgery. This is a suture technique to match her left eye to her right eye. In this patient's case, this up and down arched appearance to her crease is really the only crease that she can have given her bone structure. This one's a little bit different. The crease comes out and flares out slightly more and looks very good on her with her brow bone shape and overall eye shape. In this patient, her eyes are somewhat round, and again, a crease configuration that is arching up and then coming back down fits her best, and it would not be in her interest to fight against her own anatomy. I do get some questions about healing, and I have lots of examples of healing pictures to show patients when they come for consultations, but even dramatic changes like this heal quickly. Here she is at 5 days after surgery, and just 2 days later, she looks presentable and can go out into public and no one really notices she has surgery. Just a few weeks later, she's looking even more natural, and by the end of 5 weeks, she looks excellent. Well, if you have any questions, feel free to give us a call at the office, and I look forward to seeing you in any of my Bay Area locations.